So, Dr. Gifford, the flu is here.
Yeah, we are starting to see it in a lot of schools, and our test results suggest more and more of the people who have influenza-like illness, fever, cough, are turning out to have H1N1.
Now, are you still testing people for H1N1 only if they are hospitalized?
We're testing hospitalized individuals. We're also testing samples, random samples of kids in schools where we're seeing some outbreaks. We're testing in some physician offices a random sample that comes in to get a sense. Up until now, only about 10% of the people who've had fever or cough have had influenza or the H1N1 virus. We're starting to see that number significantly go up just in this last week.
You know, the winter brings more indoor activities, school dances, indoor sports activities. Is that a concern for you?
Well, certainly we know how the virus spreads, close contact with people coughing and touching and not washing their hands well. So if people are sick and have a fever, they shouldn't go to those activities. And if you're going to those activities, I'd use the alcohol hand gel well. I mean, that's the advice I give my 17-year-old son.
At what point would the Department of Health shut down an activity like that, a sporting event or a school dance?
We have no plans of shutting them down at this time. Really, it would be if we see a mutation in the virus and it really changes with what's going on out there. The only other reason we might shut something down is that if so many people are sick, they just can't staff it and run it. But this is seasonal flu activity. It is causing some people to get sick and be hospitalized and have real bad complications. But a majority of people stay home, fluids, Tylenol, rest, and they get better on their own.
You just gave advice to parents, if the kids are sick, don't let them go to that event. But what are you telling schools on how to handle events like that?
The same thing. I've had a number of calls with some of the school principals. I've had some calls from the mayors. I've had some calls from the school committee members, and it's the same message I'm giving over and over again. You don't have to cancel them. You don't have to do any special cleaning. It only lives for a couple of hours on there. When schools are closed overnight, it cleans itself because the virus can't live that long. High contact surfaces you might want to wipe down once or twice during the day, but nothing special. And again, really emphasizing if people have a fever and they're coughing, they need to stay home. That's how it spreads around. And the more you wash your hands, because it's touching your eyes and mouth, that's how you pick up the virus.
Let's move on to the vaccine. For example, my 3-year-old daughter got her flu miss today. My 1.5-year-old son couldn't get his shot. So obviously we're anxious for them to get the vaccine. What are you telling parents about what you're hearing as far as availability?
Well, I'm in the same camp. I'm anxious for my son to get the vaccine as well. It's coming in slow, and it's very frustrating. We anticipate getting enough vaccine in to start vaccinating in the school clinics, probably starting the week of November 2nd, but probably running all the way to the middle of December. We just aren't getting enough in to do it faster. If I could do it faster, I would. And then preschool kids, like your kids, who are between 6 months and 5 or 6 years of age, they can go to the pediatrician's offices and get the vaccine now. Right now, all they have is the nasal spray, and that's for 2-year-olds and up. So for a year 1.5 or kids under 2, they're going to have to wait for the injection. That should be in the pediatrician's offices in about 2 weeks.
When there was news early on that was promising that it might only take 1 dose, but for kids, we now know it's going to take 2. Is that accurate first?
Well, sort of. Yeah, it is accurate. We know that we were concerned that everyone might need 2 doses.
Right.
Adults, which the federal government's defining as 10 and over, just don't tell my son he's 10 and over. 10 and over as adults, they only need 1 shot. 9 and under need 2. That's just like seasonal flu. Seasonal flu for 9 and under need 2 shots.
Well, what's the effectiveness after that first shot, because they're spread out a month apart?
Actually, this vaccine for H1N1 is like a perfect match with what's going on out there. And so we're seeing a really good immune response. And after that first shot, we're seeing actually higher than what we normally expect after seasonal flu or other vaccines of people getting protected, but they still need 2 shots for the kids under 9.
From your perspective, you see the numbers coming in from the random sampling. Any surprises yet from where you stand?
No, I actually expected us to see more of H1N1 based on how it spreads, given that we were seeing some early on in September when the college-age kids and everything came back. I thought we'd see it by the beginning part of October. So we missed it by about a week or two. Predicting influenza is really complicated, so actually being off by about 2 weeks isn't that bad.
I got to ask you about E. coli now, the E. coli outbreak in Lincoln. Do you have any updates on that?
Well, we know 212 kids from the Lincoln Middle School went to a camp in Plymouth. 15 of them so far we know got sick and had some bloody diarrhea from the E. coli 0157. 2 of them have been hospitalized. They're doing well. They haven't had the real bad complications, thank goodness. And we're working very closely with the USDA and the Mass Department of Health. So far, no evidence that this has been human-to-human transmission. It really looks like something that they probably ate, and we're interviewing everyone to sort of figure out what that is.
Have you been able to narrow that down yet? I mean, that's the million-dollar question.
Yeah. No, we haven't narrowed that down yet. We also are talking to all 212. We're doing the history. You know, you got to talk to everyone, what they ate, what they did, who they had in contact, and then look for similarities between there to figure that out, and then start doing some testing. And we're moving as fast as we can. Doesn't quite work as fast as CSI on a TV.
Right, the forensic.